Hello and welcome to this week's edition of Healthcare Heroes, where we recognize our dedicated frontline staff and managers. I'm Sandy Potter, joining you today from my home studio, along with Masonicare President and CEO, JP Venoit, and Raina, our Director of Facilities at Masonicare Health Center and the Lower Campus Apartments in Wallingford. Thank you both so much for being here.
Thank you, Sandy.
Raina, we're so excited to be talking to you today. You know, when the COVID pandemic began, your department really had to respond instantly with increased safety measures and new procedures. Can you tell us all about the actions that you took and continue to take every day to protect our residents and our staff?
Sure, absolutely, Sandy, and thank you for having me on today. This is wonderful. I do want to say, if I can hog this for a little bit, I do want to do a big shout out to the environmental services team here at Masonicare Health Center and the Lower Campus Apartments. Housekeeping facilities and laundry are celebrating National Healthcare Environmental Services Week this week. So big shout out to them. They're an awesome team to work with. I couldn't be any more proud and pleased of their efforts. So thank you to everybody. So to your question, how have we managed through this and what have we done? I want to say too, I'd like to do a shout out to Masonicare corporate and the leadership here at the health center, because one thing that is very, very clear is we could not have done as well as we've done here, and we've done phenomenally well, if we didn't have the daily communication and the daily interaction from a corporate level on down. So that has helped a lot. It's saved us time, and it was an efficient way to get us the information that we need from regulatory agencies like CDC, CMS, and local DPH and state DPH. So for us, you know, I think that a lot of the preparedness we did happened well before the pandemic even hit. And I think back in the fall, we started to look at a little bit of a different shift in how we view ourselves and our role here at the health center. People usually view environmental services, whether it be laundry or whether it be, you know, the cleanliness of the room as a visual thing. Is your room clean? Are the floors shiny? But we took a little departure from that, and in the fall, we really studied our role here as infection preventionists, and working with Stacy Finch and the quality team. We really did a deep dive into that and started to invest a lot of time and resources into training our staff as frontline infection preventionists. So back in the fall, I'd like to also say to our leadership team in environmental services that they all went to a 2-day educational session and got certified from the Cleaning Management Institute in best practices in healthcare cleaning. So that was a big deal. And that was the foundation that helped us move forward. We also did daily huddles and education on a daily basis, focusing in on, you know, what are the pathogens that we deal with here at a health center? What are the best practices? Do we have all the tools in our arsenal to do the best job that we can? So we wound up changing some things up and looking at newer technologies and better cleaning agents, and we actually dropped our disinfection time, our dwell time, as they would say, from 10 minutes down to 1 minute or 3 minutes based on what the pathogen was. So that was significant. So those are the types of things we did. And so when the pandemic hit, we kind of had a good foundation of which to build off of. And we just, you know, focused in on what does COVID-19 mean to us? How are we going to keep this building clean? We looked at, you know, changing up our assignments a little bit to make sure we were focusing on priorities. And, you know, that's how we handled it. We also found that there were other services within the building that weren't front and center. We had to slow those operations down. So we pulled in resources from other departments to make sure we could thoroughly disinfect this campus every day.
Well, it's just a monumental job that you do, and you make it look very effortless. And JP, it can't be said enough that preventing the spread of this virus is truly a team effort, and Raina's staff has really been phenomenal.
When we talked through kind of what Raina and the staff went through for really combating the virus getting into any of our campus is truly amazing. And Raina's another example of, you can hear the passion in her voice, not only for doing what's good for the organization, but making sure that our staff are properly trained and properly equipped to help combat this virus. And, Raina, please extend my thank you to all the staff. They every day do an amazing job. And this is just another example of fighting that invisible monster that they've been able to help the rest of the organization combat. And it's truly a representation of who we are as an organization, and the results that we've had thus far is really attributed to your leadership and all your staff within the healthcare center to do what we've been able to do. So thank you so much, and I thoroughly enjoy that listening to that passion.
Thank you. We are passionate, the whole team is, and we're very proud of our record so far. So I have to tell you that is another strategy that we use when we would meet daily. We'd say, okay, well, we're this many days without, and there was always the momentum to want to go forward. And I think we can all be really proud today.
Absolutely.
Absolutely, very proud. Well, thank you both so much for sharing time with us today. And Raina, thank you and your team for your continued commitment to the health and safety of everyone at Masonicare. You are all, as JP says, Masonicare strong.
Thank you very much.
Bye-bye.
Thank
you.
Thanks for watching at home. I'm Sandy Potter, and we hope you'll join us next time for another edition of Healthcare Heroes. Until then, be well.